Sorry.
Do I have permission to record you for my therapeutic interventions 2 course?
Yes.
Okay. All right. So today we have Tom Harris, who is in for right Achilles pain while playing recreational basketball. He's a 28-year-old male. So when he walks in, I'm initially going to do just a posture assessment and a quick glance over. So I'm checking the injured site, looking at excess pronation and supination of the feet, working my way up, double checking that knees don't have any excess varus or valgus, and then go ahead and put your hands on your hips, checking to make sure that the posture of the pelvis is in line, so that way we don't recognize any imbalances, to make sure that we can correct those. And so as I'm standing here, I'm just going to go ahead and come behind, and is it okay if I touch you? Yep. Okay. So I'm just going to feel for any calf tightness and Achilles tightness while they're standing, and check bilaterally to ensure that the differences are going to be visible and noticeable while palpating. And I can clearly tell that the right side is going to be a little bit more stiff than the left. So I'm going to go ahead and move on to the dynamic movement posture assessment, which is going to be a lunge test. So I'm checking here for any heel lift off during a single leg forward lunge. So I'm going to have you go ahead and do a forward, start with your left foot forward first. And in this, I am noticing that the right foot heel lift off is happening. So that is going to indicate some calf tightness. And then go ahead and return to neutral. And go ahead and do that with the right foot as well. And I'm recognizing that there is also heel lift off with the left foot, which may indicate bilateral calf tightness and Achilles tightness. But we'll go ahead and double assess that. So I'm going to go ahead and have you sit up here on the table for me. All right, so for this, I'm going to measure active range of motion and passive range of motion. So for the right foot, I am going to have neutral be a 90-90 for the ankle. And I'm going to line my goniometer up. And then go ahead and push the gas pedal so as far down as you can go. And through this, I'm going to see that there is a normal range for plantar flexion, and then go ahead and bring your foot up as far as you can go. And within this, I am going to see a decreased range of dorsiflexion, and there will be pain in the athlete. And I would do the same thing on the other side, just double check that the ankle has full plantar flexion and dorsiflexion. From there, what I'm going to do is I'm going to do some passive range of motion. So I'm seeing the neutral, and I can go in a little bit further extension. And then what is your pain whenever I'm doing this?
It hurts.
Painful? Okay.
Yes, it really hurts.
And then for full, go and relax. Full plantar flexion.
That's fine.
Gotcha. And then from there, I'm going to do manual muscle testing of dorsiflexion and plantar flexion. So go ahead and pull your toes up to your knees for me. Good. And then push the gas pedal. Good. Okay. Was there any pain with either of those?
Yes.
Gotcha.
Whenever I was pulling my toes to my nose.
Gotcha. So there, with resisted dorsiflexion pain, we're obviously going to see some sort of gastroc tightness or soleus tightness. And for the initial care plan, what I would start with is for rehab, I would go ahead and have the athlete do the ABCs, the ankle ABCs. So I'm going to have you pretend like your big toe is a crayon and you're trying to write the ABCs on an invisible piece of paper. Okay. There we go. And this is just going to promote blood flow to the area and start using more ankle muscles and calf muscles to bring that ankle into dorsiflexion and plantar flexion. From here, I would have them do foam rolling for like 30 seconds on each calf, probably twice before we move on to stretching. The next move is going to be seated hamstring stretches, and with this we're going to focus on pulling the toes up to the nose, and as we're doing this we're going to just try and reach down as far as we can and touch your toes. Good job. And you should feel a good stretch in your calves as well as your hamstrings, which is going to help that posterior chain flexibility. And then from here we're going to work on PNF stretching. So what I'm going to have you do is just relax. Okay, so I'm going to force the foot into dorsiflexion as far as we can go, hold it for a few seconds, and then I'm going to have you push the gas pedal. We're going to do 15 seconds, and then from there I would say, okay, go ahead and relax, and then push further back, and you should get more range of motion for dorsiflexion in that area. And then as for sending them home with active range of motion stretches, what I'm gonna have her do is I'm gonna have her do single leg heel raises. So go ahead and stand up. There we go. So for these, what I'm gonna have her do is I'm gonna have her do ankle leg raises. So basically just a calf raise, standing up really tall, and then slow and controlled on the way back down, and then up, and slow and controlled on the way back down. There we go. And then we'll do single leg deadlifts. So like single leg touchdowns. So just working on that ankle dorsiflexion, going all the way down and coming back up. There we go. And you can do this next to a table as well to ensure that they have good balance. But that's just going to work on that loading with the dorsiflexion in that position for the ankle. For my modality for this, I would use instrument-assisted soft tissue massage or Graston, and I would do that for probably 2 to 3 minutes if whenever the percolation starts. Percardia?
No.
Percolation?
Yeah.
Whenever the little red dots on the skin show up. And then I would use the scanner first and progress to the Achilles specific instrument with the fan blade inside. And then I would ask if the patient has any questions for me and obviously answer those. And then I will have the care plan for balance, stability, and neuromuscular control sent in outside of this video. Thank you.